Hi, I'm Jeffrey Lowe, and I'm a current PGY1 resident at Emory University Hospital in Atlanta, Georgia. Today, I'll be presenting outcomes in renal transplant patients with COVID-19. Very briefly, I nor my advisors have anything to disclose for this project. Since December 2019, over 26.3 million people in the United States have been infected by the novel coronavirus. Anecdotal evidence at Emory University Hospital suggests that renal transplant patients experience a more severe disease course. The majority of literature regarding COVID-19 and renal transplant patients is small in scope and focused on the management of infection. However, there is a scarcity in literature regarding the mortality and severe coronavirus infections in renal transplant patients. Thus, the purpose of this project is to investigate the mortality rate of critically ill renal transplant patients with COVID-19. This was a retrospective chart review observing a 6-month period in 2020 between March 1st to August 31st. Patients admitted to the intensive care units of 4 Emory healthcare facilities were studied. I have listed the details of these facilities and the number of ICU beds for your reference. The primary outcome is mortality rate. Secondary outcomes included length of stay, changes in immunosuppression, new thrombotic or bleeding events, rate of concurrent infections, rate of renal replacement therapy, rate of mechanical ventilation, and readmission within 30 days. Selected significant secondary outcomes will be discussed in this presentation. Patients who were at least 18 years of age had a positive COVID-19 test confirmed via PCR and admitted to the ICUs of Emory Healthcare were included in this study. Those who were discharged within 24 hours of admission or those who tested positive for COVID-19 greater than 30 days prior to admission were excluded for this study. Our primary group of interest were renal transplant patients. For comparison, we included 3 additional groups including other solid organ transplant patients, immunocompromised patients, and non-immunocompromised patients. Unfortunately, we had a low number of renal transplant, other solid organ transplant, and immunocompromised patients that met the inclusion criteria for this study. And though we had many non-immunocompromised patients meeting the inclusion criteria, a decision was made to randomly select 15 of these patients for comparability purposes. These are some of the baseline characteristics of our subjects. Of note, our renal transplant patients were not statistically different from the remaining groups of this study. The comorbidities are listed here for your reference. I'd like to highlight the differences in hypertension and renal dysfunction among our patients. 100% of the renal transplant patients had a diagnosis of hypertension and chronic kidney disease. However, this last comorbidity may be unsurprising as this diagnosis stays with the patient even after transplantation. Finally, I'll be discussing some of our outcomes for the remainder of this presentation. Our renal transplant patients had a mortality rate of 66.7%, which was higher than all other groups in this study. More importantly, this was significantly higher than all other groups combined, which is labeled here as a pooled cohort from this point forward. In terms of time spent in the hospital, the average hospital length of stay and ICU length of stay was only significantly longer for renal transplant patients compared to other solid organ transplant patients. Otherwise, length of stay was similar across all other groups. Renal transplant patients had significantly more immunosuppression regimen changes than the immunosuppressed group in the combined other solid organ transplant and immunosuppressed cohort. Dose reductions of immunosuppression rather than termination of immunosuppression was more common in our renal transplant patients. We analyzed the rate of renal replacement therapy and mechanical ventilation, as utilization of these treatment modalities may indicate a more severe disease course. Here you can see that renal transplant patients require dialysis significantly more than all other groups combined. The story was similar regarding the need for mechanical ventilation. The higher utilization of these two critical therapies suggests that renal transplant patients experience a more severe disease course. Lastly, we investigated the use of selected drug therapies, first of which is corticosteroids. We found that renal transplant patients were initiated on higher intensity steroids more often than other patients, which may suggest that they may have failed previous lines of corticosteroid therapy more often than other groups. The three most common corticosteroid regimens are listed on the left for your reference. Another interesting point is that renal transplant patients were on multiple vasopressors more often than other patients in this study, suggesting maintenance of hemodynamic stability may be more difficult in renal transplant patients infected with COVID-19. In summary, compared to all other critically ill patients with COVID-19, renal transplant patients had higher mortality rates, required more renal replacement and mechanical ventilation, and had increased usage of higher intensity steroid regimens and multiple vasopressors. These points support our hypothesis that renal transplant patients with COVID-19 experience a higher mortality rate and possibly a more severe disease than other COVID-19 patients treated in the ICU. Regarding limitations, the retrospective nature of this study and small sample size restricts the applicability of these results. Furthermore, standard of care changes for COVID-19 over the course of the pandemic and medical practice differences likely affected the outcomes of these patients. Future studies would benefit from matching subjects based on acuity using validated scores such as the Apache 2 or SOFA score, and also increasing the study size. A large number of subjects would enable multivariate analysis to identify risk factors for severe disease and death in critically ill renal transplant patients infected with COVID-19. Here's my assessment question. Which critically ill population had the highest mortality rate? The answer is renal transplant patients, who had a mortality rate of 66.7%. Thank you for your time and attention. If you have any questions, please feel free to contact me at the email listed here.